Good afternoon. Welcome to the Human Service Committee meeting. We'll start the meeting today with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Can we start with roll call, please?
Mrs. Burdick?
Here.
Mrs. Ricketts Swales? Here. Mr. Barnes? Present. Mr. Bissett? Mrs. Hanchett? Here. Mr. Healy?
Here.
Mrs. Root? 5 present, 2 absent.
Thank you. And can I have a motion to approve the agenda?
Healy will move it.
Ricketts Swales, second.
All in favor?
Aye.
And that's carried. And approval to the minutes of July 16th, please.
Hanchett will move.
Ricketts Swales, second.
Any corrections or additions? All in favor?
Aye.
And that's carried. And Anita is not here, but Kimberly is for Office of the Aging. Welcome, Kimberly. You all have the monthly report.
Thank you for having me. On our monthly report, there's a couple things I just want to highlight. Primarily is our health insurance counseling. If you look at the same month last year, we served about 145 people, and this time we have 333. So that is, I feel like every time we come here, we talk about how more and more people are aging into Medicare, and as it gets more complex, people need a little more assistance in helping determine the best plan for themselves. So that is part of the reason that's up so high.
But this isn't open enrollment. This is just people
Right,
that are
this
now
is-
turning 65
Yes.
and need the additional help.
Yep.
Okay.
Open enrollment starts in October, so we will
So-
see what we do then.
We'll see what the numbers are that month, huh?
Earlier this month, we had everybody's favorite event, the senior picnic. We did serve 462 seniors. It was wildly successful. The weather was beautiful, and everyone was very happy, and we actually have not heard any complaints,
Good.
which is unusual.
Good. Yeah, I know several of us were there, and I think it went very well, so thank you.
Yeah, just a couple fun facts in case you missed it, or if you weren't there. We do an award every year for the eldest male, eldest female, eldest veteran, and longest married couple. The eldest female in attendance was 102. The eldest male, who was also the eldest veteran, was 94, and the longest married couple were married for 73 years.
Which is amazing, yeah. Very good.
Yep, it was a really good time.
It was. Please thank your staff for a great job as always.
I will.
All right, so we have several things we need to approve tonight, today. The lease agreement, we'll start with that.
Yep, this is for our Bolivar-Richburg luncheon site. Previously, it was at the Bolivar Fire Department. We have since moved it to the Richburg Firemen's Clubhouse. There has been a lot of positive feedback about that. There's much more parking. It's a little more spacious. So I've been out to the site a couple times, and they really enjoy it.
So it's working out okay.
Yep, it's been great.
Okay, good. Can we have a motion to approve this lease agreement, please?
Healy will move it.
Barnes, second.
Any comments? Is the cost similar to what it was before?
I believe it's exactly the same.
Okay, thank you. All in favor?
Aye.
And that's carried. The Deputy Director of Aging?
Yep, this is just a request to fill this position. We created it, I believe, about a year ago, and it has not been filled at this point. So we had a meeting, discussed what exactly we need from it, and we're just looking for permission to get it filled so we can have a little backup for our director.
Okay, can we have a motion?
Ricketts Swales,
Second? I'll second it. Any discussion? I just want to make sure that, I know there was a lot of discussion about this back and forth, and I just want to look at the back table and make sure that everything has been, now is done correctly and ready to go.
I think it's ready to go. I think, I am sorry, I can't recall if we talked about doing the backfills in this budget year or not. I know we talked about having the deputy director hired in this budget year, but I don't remember on the backfills.
I believe we did, that's the coordinator of services position would likely be the backfill.
So you're, just to make it clear, we're adding a whole extra body to this.
Correct,
position.
and it
Okay.
was accounted for in the budget.
Okay.
Okay. I guess my other question is, it's in this year's budget, and I assume it will be going into next year's budget?
Yes.
And that's not going to be an issue?
Nope.
Okay. All right, so if anybody else has any questions? If not, all in favor?
Aye.
And that's carried. All right, so then we are doing another position. This is an existing position, and is the deputy, the aging service technician, correct?
Yes, this is an aging services technician that we're looking to fill. It's a position we have on the books. It's just vacant at this time. We did account for it in the budget. We just did not have permission to fill it yet. We are hopeful that they are going to assist with the new transportation grant that we received to help further our transportation program, as well as do some Meals on Wheels assessments and potentially insurance counseling as well.
Okay, can we have a motion to accept this?
Ricketts Swales will move that.
We have a second?
Hanchett will second. As far as the transportation, the grant that, can you remind me a little bit about the grant? And obviously, this person's going to be paid out of several
A
different
part of
grants.
it will, yes, part of it will, and it was partially funded. It's assisting with the rural transportation. It is contingent on the grant funding. The grant will sunset in June of 2027, and at that point, if we're not able to secure additional funding, then this position will be eliminated.
Is that added services for our seniors?
This is a pretty massive expansion of our transportation program as it is currently.
I was just curious because I've had questions about it, what kind of services. So it will entail medical transportation.
Yep, we do a lot of groceries and errands, people that have to go to the pharmacy, to the post office, to the bank.
I know somebody was asking about taking people to hairdressers, so.
Well, unfortunately, we have to go kind of by priority.
Okay, good. I just was curious about that. Thank you.
Yep.
And again, I'm going to look back at Carissa and just, for those not aware, there was a lot of emails and back and forth about these positions, making sure that they were done correctly and that the funding was in place and the codes, the account numbers, and I just want to make sure that everything got corrected before we approve them.
I think this one's correct. We're not creating a position, we're just asking to fill an existing position. And if we're only asking to fill it so long as there's grant funding, you'll just want to make sure that's noted in the minutes, because there's no resolution. We'll just want to make sure that sunset is in the minutes for the filling of the position.
Okay. And that is in the minutes, right? Okay.
Madam Chairperson?
Yes, Mr. Healy.
I'd just like to point out that this request to fill the position we're talking about is 85% state, 10% other, and 5% county. And most of these positions that we have filled or are about to fill are mostly funded from outside money and not with local taxpayers' money. Thank you.
Thank you. All right, any other discussion? All in favor? And that one's carried. And then now we go to the site managers.
Yep, and these are just standard, they're positions we already have. They run our luncheon sites. We have had 2 site managers lately elect to retire. So we're looking to fill 2 of those and also 2 substitute positions to avoid having to send somebody from the office out to cover the luncheon site or close it.
All right, okay, can we have motion to approve these?
Hanchett will move.
Healy will second.
Any discussion? And again, I'm just going to check with Chris and make sure that these are all set and the right language and everything on these.
I believe so.
Okay, thank you. All right, all in favor?
Aye.
And that's carried. Then we are going to go to the drivers, and we are looking to fill 5 positions there.
We're actually looking to create a couple more and fill them, and this is to account for basically substitutions, drivers that are out. We do currently have 2 out on medical leave, and we have been very short-staffed, so we're looking to kind of ease the burden on the drivers that we do have.
Okay, can
Healy will
we-
move it.
Second?
Ricketts Swales.
And I hate to keep doing this, but Chris, I'm just want to make sure that, again, this has been all cleared.
This is, I'll just note where it says, like 4th line down, this position is an existing position. you had these titles existing already, but we are creating these extra titles, just to clear it up. Sometimes the form's not always clear to you, but these are new positions that we're creating.
Okay. Is that correct, Kimberly?
Yes, yep, and outside of just the initial training period, I don't anticipate a large fiscal impact just because most of them are going to be substitutes filling in where we would have already budgeted a driver.
Yes.
Any other questions?
I guess basically making sure as we go into, do we have the funds to keep it up?
Yes, yep.
Okay.
We want to be able to keep delivering without having to send, the accountant out to deliver meals, which is a great experience.
It's fun when we go too. And it is a great program, I know that. And I personally know what a blessing it can be now since my parents, even for me, so.
Yeah.
But anyway, we're just making sure we're covered in budget and
Yes, making sure
moving
that we will
forward.
continue delivering.
Thank you.
All in favor?
Aye.
Oh, Mr. Barnes, sorry. Mr. Barnes.
Yeah, originally, weren't most of the drivers just volunteers?
We do have, I think, 14 volunteer routes. We have 9 paid routes. The volunteers are coordinated in the office, and a lot of them drive, like every Tuesday or once a month. So there's Karen has, I think, 250 volunteers at this time that she oversees. Not all of them do Meals on Wheels, but there are 12 volunteer routes.
So what's the difference between a volunteer route and a paid?
The volunteer routes are typically shorter. You should be able to finish them in an hour or so. Sometimes people do it on their lunch break, just run out, deliver meals, and come back. The paid routes are more for more difficult places where you're driving down a dirt road for 5 miles, or the driveway is really steep, or just places that we really don't want volunteers going in case something happens.
So over the last few years, has anything changed, the number of volunteers versus the number of paid drivers?
I feel like we're constantly losing volunteers. A lot of them are seniors themselves, and it's getting harder to recruit people that are willing to come in. As the routes get longer, we have broken them up a little bit here and there just to kind of suit everyone's needs as far as the clients.
So in the future, it looks like we're going to have to hire more on paid and not rely on volunteers.
We're hoping that we can continue to keep the volunteer program going. It's nice to, for people to be able to pitch in and help out in the community if they can't dedicate 3 or 4 hours of their day to deliver. It's a nice opportunity for some people to get out for an hour, hour and a half and see those people and bring them a hot meal.
Thank you.
Thank you, Kimberly. Any other questions? All in favor?
Aye.
And that's carried. Okay, now the next one's going to sound weird. This is for I'll let you explain what
Okay.
happened with this.
We are looking to create and fill 3 grounds worker positions. These positions will replace the 3 part-time laborers that we currently have. We created the laborer title within our department to function basically as it's called a PC1 aide. They can do housekeeper chore services, and we started this to combat the lack of aides in the area. So there are a lot of places that the traditional agencies can't get to because they don't have aides. And rather than keeping those people on a waiting list, we created our own positions to go out and do those services so those people would get served. We are now looking, because of the workload that they have, instead of part-time, we wanted to make them full-time. So really, 2 of these positions were just moving people that are already there into them, and then we'll hire 1 more. This is just the title that we found that would work for what we were trying. It's the closest we could get.
Okay, can we have a motion for
I'll move it.
a second?
Ricketts Swale.
Okay, any other discussion?
Just, I think, point out that this is 100% funded by the state.
Yes,
Correct.
it is.
Thank you.
Salary and fringe.
Chris, I'm sorry. Could you just explain again why we went from the labor to a groundskeeper and how that is going to work as far as hiring? It will be competitive, correct?
It will be. So right now, we use labor in the DPW department as well. Labor for DPW is a 40-hour employee. When we were using it in OFA, it's a 35-hour, so there's a little confusing there. Switching it to a different title will end that confusion so that we have a different title for the people that are doing 35-hour work with OFA than we're already using for DPW. I just also want to mention that we are eliminating those positions of the part-time laborers in OFA. So, but yes, we will be starting from scratch on the hiring, but I believe it should work out okay.
Does anybody else have any questions?
I do just want to note that it was noted here that we request it referred to personnel on September 3rd, so we can get it moving and get people going.
Okay. All in favor? And that's carried. And I believe we have one more, and that is for a typist.
This is a request to fill a full-time typist position, and this will be for our front desk. I know we highlight probably every month the way that the calls continue to increase exponentially at this point. And we currently have a couple part-time typists that rotate coverage, but having a full-time person with the part-time that rotate around them will really make it so that we can answer the phone and not be letting calls go to voicemail.
Can we have a motion?
Ricketts Swales.
A second? I'll second it. Any discussion? And this is in the budget?
Yes, this was accounted for last year.
Okay. Any other questions? And we're okay with this one too, right, Carissa?
Yes, you are adding a body, but that's
Right.
what we're asking to do.
Okay. I'm just going to make a comment as far as budget goes. I think next year we're going to have to be looking really carefully at creating any new positions. And so it's good that you're getting this in now.
Good to know.
We just don't know where we're going with state and federal funding. And I think that we all need to take a very close look at next year's budget and what's going to happen because we don't know. Okay. So all in favor?
Aye.
And that's carried. Anything else today?
That was all I had. Just thank you very much for your patience and
Thank you.
understanding. I don't do this all the time, so
You
I
did-
appreciate it.
Did a great job. Thank you, Kimberly. All right, next we have Tyler Shaw, Public Health Director. Welcome, Tyler. How was your time away?
I'm happy to be back.
Well, glad to have you back. All right, anything you want to point out on the monthly report?
Yeah, you'll see we closed out our TIC grant, and there's some pictures in the monthly report. So we have some warning signs for ticks that are present on some trailheads, and we also put up some brochure boxes that have some tick kits in them, as well as some information on tick-borne diseases. So you'll see those across many different trailheads across the county. There's a nice little QR code, too. If they do find something that's empty, they can reach back out to us, and we'll go out and fill those boxes back up.
Great. Do you want to just give us an update on how the fair went?
Yeah, so we also have a picture on there. We saw about over 1,200 visitors to our booth, and we had over 25 individuals sign up for radon test kits, so that's awesome news.
Very good. Very good. Okay.
Great turnout.
Yeah. Request to fill a public health technician.
Yes, request to fill, this is due to a resignation, and this is the technician that covers mainly our HUD-led grant.
Can we have a motion to approve that?
Angie will move.
Helio, second.
Any questions? All in favor?
Aye.
And that's carried.
Next up is our standard, it's our immunization action plan grant. This is part of our 5-year block grant, and it totals $31,050 per year.
We have a motion to approve that.
Angie will move.
Ricketts Swales will second.
Any questions? All in favor?
Aye.
And that's carried. Anything else, Tyler?
That'll do it for me.
All right, thank you.
Thank you.
All right, now we're going to have Don Horan from the Commissioner of Social Services, and we're just going to kind of skip the month report if you have any questions, unless there's something you want to highlight, because I knew you had some other things you want to talk about.
Right. The only thing I want to highlight on the monthly report is the childcare, which is daycare. We continue to close those cases due to lack of funding because we did not get enough funding from the state that was pushed down to the county. So we continue to close there, so we'll continue to see those numbers go down. Any other questions?
Any,
I have a question about that. So as you're closing them, are we getting close to balancing it and not being
We're very close.
over?
The allocation that we got for this year, we were able to add some rollover money to that from prior years. And then out of the 50 million that was left for upstate out of what New York State did, we received another $250,000 for that. And we were projecting 1.6 million for the program. And we're just projecting a little bit under 1.6 million, about 1,550,000. So we have a bumper of about $20,000 right now to get to September 30th. And then the new fiscal year will start on October 1st, but we will not receive that rollover money. That money is gone. That was 200,000. And then there's no guarantees and there's no reallocation or commitment from the state that they will have another round of the 50 million for upstate for the 250,000. So right out of the gate for starting October 1st, we're already short $450,000.
So what was the total amount the state decreased the funding this year? Do you know that figure?
The allocation stayed the same. It was 1,149,000 was the original allocation for federal fiscal year 24-25. And then we were able to add the $200,000 rollover to that. And then with the 250,000 from the 50 million that the state did. So for the new year, 25-26 federal fiscal year, we still received 1,149,000, but the other monies, the 450,000 that we had, is gone unless the state does something.
Could you remind us again what the income level is that people are eligible, and this is where the problem is?
Yes. They just did a COLA, so a family of four now at the state median income, 85%, is $110,000. For a family of four can still receive daycare. They have now put out 300% of the federal poverty level, which is still $98,000. And then based on the last sentences, a family of four in Allegheny County's average income is $62,000. So we're still at the point where if we had the money, everybody that had a qualifying child would qualify for daycare.
Don, what's the standard for the federal level? Do you know, under the federal requirements for the program, that the states are required to use what their minimum is?
I do not know that.
But we're far, the state has far exceeded what the.
Oh, absolutely. Far exceeded that.
So I think what I'm hearing you saying, a program that is meant to help underprivileged children or that need that extra help really has really kind of been damaged by the state by raising it. So what's happened is some of the really most neediest families are not getting it because of raising that. And it's putting us in a financial predicament on covering that program.
Yes, absolutely.
So,
Yep. Because we can't pick and choose who we close. So if you're coming up on closure and your average income is $30,000 a year for somebody, like you said, that really requires daycare, we have to close your case. Where somebody that is under a 12-month guarantee that might get another couple months might be making $80,000 a year.
And the consequences of this is people quitting their jobs
Oh, yeah.
and then collecting additional benefits from the county. And so it hurts everybody all the way around.
Plus the private businesses that are daycares can't fill their slots, and then they have to look at their business model too.
Yeah.
Yeah, so it's affecting, there's a whole stretch of people that it's
Right.
going to affect.
It's a really big economic factor for the county. So,
And the part that I find very discouraging and sad is that the people that need it most may not be able to get it anymore. And that's not right.
no,
But
it's not.
that's nothing we can, Don has been very active sending emails and writing letters to the state, trying to get this resolved. And so just keep us up to date. I don't see any change anytime
No.
soon, but we can hope.
Yep.
And keep up the
So,
good work with, I know you're in a tough position because you have to tell people now that they no longer can have childcare.
So, unfortunately, so.
Okay.
But-
Any other questions on the childcare issue? All right, we'll move, go ahead, Don, to your next.
Would it be okay to talk about youth court right now?
Yes.
Okay. Social Services has been partnering with probation. I have Mr. Grantier here with me. We have started an initiative to start a youth court within the county for kids that qualify for Raise the Age, which would be a child that's 16 or 17. I do have money in the budget that's labeled as RTA for these type kids. And we are doing a joint venture with CORE, but Social Services has kind of been the silent partner, and Scott has been kind of the lead on it. So I invite Scott to say a couple words about that.
Welcome, Scott.
Thank you very much. Good afternoon. Last week's public safety, I kind of held back some enthusiasm. I can let it go a little bit now. I'm excited to kind of tell you about this endeavor. And first of all, thanking Don and county administration and CORE. Seeing this come together has been really special, and a lot of conversations have happened over a year now to get to where we are now. And I think what we have a plan to put in its simplest form is we have Raise the Age funding sources. We have STSJP funding sources, which were approved through public safety. And how do we utilize those resources that are state grants on a yearly basis to make youth services and family intervention services the best we can for Allegheny County. And that's the spirit behind what the state wants us to do with this. Our models or our programming should not look anything like Steuben, Chautauqua, Wyoming County. The purpose of the funding with Raise the Age and STSJP is to make it what works for Allegheny County. And I think we have a very promising, cost-effective and high potential for good outcomes in our partnership with DSS and CORE Learning Center, which is a tremendous resource in our backyard. One of the things that is, one of the many special things about this plan is that we are no longer looking to take state monies, pass through and support and fund positions and programs that are not based in Allegheny County. This is a very home base tenet through all of it as far as supporting local programming, and the services they're providing at CORE are tremendous, and I can't say enough about them and their partnership thus far. And also, when these children and families age out of the programs, there's a very seamless transition into the adult program for job readiness, alternative education programs, their linkage with BOCES, with Alfred State College. I mean, this just has a very positive energy to it for the long term. I'm very confident that these funding sources through the state are not going anywhere. I think the longevity of this plan is very solid. I hope we're coming back in a year from now with a very successful year behind us. And again, thanks to DSS and CORE and so many people, I think we're on the right track.
Great.
So-
We'll be anxious to hear how the year goes
Yeah.
and how
And-
successful it is.
And one part of this, kind of the Youth Justice Service Initiative, is a youth court funded and operated through CORE Learning Center, which has been something that's been very much needed for quite a while.
Well, thank you for, both of you, for getting this going, and hopefully we'll see some success next year when you give us a yearly report on it. Look forward to it. Okay.
Questions?
Any questions? Thanks for coming, Scott. Appreciate it. All right, Don, you have several things for us to approve.
Do you want to do both NCAs together?
Yes, I think, yeah, because they're just, yeah, let's do both of those. The first two on your report will be together.
These are grant opportunities through the National Children's Association. This money has been applied for to support the Child Advocacy Center. And the first grant for CORE will mostly be used for salaries. And then the second one will be used for outreach materials and supplies and other operating expenditures at the CAC.
We have a motion to accept both of those.
Ricketts Swales will move it.
Helio,
Second.
second.
Any questions or comments? All in favor?
Aye.
And that's carried. And then I think we can do the next 1, 2, 3, 4, 5, the renewals altogether.
Okay. The first one is going to be the renewal of the cooperative agreement for the Child Support Enforcement Unit for the County Attorney's Office. That's a fee that we can pay for them because they supply the attorney that prosecutes our child support cases. The next one is going to be the cooperative agreement for child welfare. That's an original agreement. We had to rewrite that several times and it's finally approved. That was approved for 2024 for the county attorney's office to represent us on child welfare cases of children that may enter into foster care or may enter into like a JD PIN type situation. And then the very next one is also for child welfare, but that's just a renewal for that. And that's based off the 2024. The next one is the renewal of the non-child welfare legal services agreement, and that's for anything that the county attorney's office does for us. If we have changes in law for supplemental nutrition assistance program, or we have somebody who may be asking the department about legal questions or maybe threatening lawsuits or something like that. And then the non-child welfare services agreement for 2025 is another renewal for the same services.
And we have a motion to approve those.
Hanchett will move.
Second? Mr. Barnes, thank you. Any questions? All in favor?
Aye.
And those are carried. And then we have a budget adjustment for the Child Advocacy Center.
Yep. This budget adjustment is requested. As you can see, for the next one is a lease agreement. This is to open up another location for the Child Advocacy Center in Wellsville, New York. As you know, we had the fire quite a few years ago at the location, and it's taken a long time to find another location with reasonable rent that we could move into to more properly serve people of Allegheny County through that program. It will be reimbursed through Ardent, through one of their grants, so there's no local share involved with this.
Okay, can we have a motion to accept that?
Helio, move it.
In a second?
Just one thing I forgot. Terry just reminded me, we were going over this MOE yesterday. The
Account numbers are wrong, yeah.
revenues on there, I will change before it goes to Ways and Means next week. 6,200, 2701 really needs to be 6,200, 1989. Other economic assistance. So I will make sure that this MOE gets revised and up to Brenda's office before it moves forward.
I'll move that as amended.
We have a second?
Hanchett will second.
Any questions? All in favor?
Aye.
And that's carried. And then the final one is the lease agreement.
Yep, and this is the actual lease agreement, permission to enter into contract with Mr. Kevin Gildner for that location.
Okay, can we have a motion to approve that?
Rickett Swales?
Second?
Hanchett will second.
Any questions? So there's been no site in Allegheny County since the fire?
Correct.
So
We've been
everything's
using
through
the
CAD
mobile
now.
unit for
The-
Allegheny
the mobile
County.
unit, Okay.
Where is this new site?
Allison, can I technically say that because it's child advocacy?
It's in the village of Waldo?
It's in the village of Wellsville,
Whoa.
yes.
So close proximity to the hospital, which is also.
Yes, it is.
Very
Yep.
handy too.
Yep.
Thank you.
Okay, all in favor?
Aye.
And that's carried. Anything else today, Don?
Nope, thank you very much.
Yep. Thank you. Dr. Anderson, welcome.
I just had this one budgeted amendment, a little bit of explanation as to what we've been trying to do. And I really want to thank Terry for making sense of this, okay? What we've done is we've taken the allocation, the 1,106,000 that used to just go to one account, and put it into all the other accounts so that now we can more closely track it. and hopefully not end up with difficulties like we did last year. So we're just asking to be able to accept an additional $207,128 from OASAS that will be dispersed through those
Okay. We
accounts.
have a motion for that.
Hanchett will move.
A second?
Helio, second.
Any questions?
It does look like it will make it easier to work with.
Well, it will at least make it so that Terry doesn't have to call me every time.
So easy.
Because I don't know the answers, and sometimes we've just, but she really has put a lot of work into this, and I'm so appreciative. so.
Okay, thank you
Thank
very
you.
much.
Thank you. All in favor? Aye. And that's carried. Any unfinished business today? Any new business? Good of the order? Motion to adjourn, please.
Ricketts Swales will second.
All in favor?